Republicans in Congress have made dozens of unsuccessful attempts to repeal Obamacare, but my next guest might have come up with a legal way to opt out. This week, he introduced a bill which would switch the power over decision-making in health care from the federal government to individual states. It's called the Health Care Compact. Oklahoma Congressman James Lankford joins me now. Congressman, an innovative idea that you've come up with, and I want to hear about it. Thanks for being here.
You bet, glad to be able to help. This is actually eight different states have done this. This is typical for most of our great ideas. They come out of the states. So 8 states have already said they want to do this. They've asked the federal government for permission to be able to come back and say, okay, we want to control our own health care. Will you allow us? As odd as that may sound, this Mother May I experiment actually comes out of Article 1, Section 10, Clause 3 of the Constitution that allows states to do compacts, make agreements with those states. There's about 200 agreements like this that have already been made over the past 200 and some odd years between states. Most of the time it's on water rights or whatever it may be. This one would be specifically health care, that the states would say, we want the ability to make all the health care decisions in our state. This would free them not only from Obamacare, Medicare, Medicaid, S-CHIP, all those things that are mandatory programs. Those federal dollars would come to the state, and then the state can make the decision how best to take care of their people. The great thing about it is the states that want to do it can do it. Other states that say that they like Obamacare, they can keep through Obamacare.
Well, I'm sure there's just a whole lot of states that would love to follow that idea. You know, if you like your doctor, you can keep him. You like your health insurance, you can keep it. If you like your Obamacare and you believe it's going to work, go ahead and keep it. So far, there are not many members of the American public believing that. Let's talk about the operational details. How does this work? Do the states enter the compact? Do they have to get the permission of Congress? Do both houses of Congress have to give them the go-ahead for the compact?
They do, actually. The Constitution itself is very specific on how a compact is done. That compact's an agreement with 2 or more states. They make the agreement, then they pass that on to Congress. Congress then approves that and be able to send it back, and it's done. So the key thing is that the states make the initial agreements. The good thing is 8 states have already done that. Texas, Oklahoma, Utah, Indiana, Georgia, South Carolina, Alabama have already said, give it to us, give us that authority. We want to make those decisions. And it comes back to this simple thing. Who is better to make decisions about the most important things in your life? You, your family, local individuals around your hospital, or someone in Washington, D.C.? Those states that want to be in the compact and myself, we believe the local leadership and families make those best decisions. That's between doctors and patients, not some bureaucrat in Washington, D.C.
Well, that'd be better than an Obama exemption that he is just passing on to businesses as he sees fit. But let's talk about the practical realities. What's the likelihood that you're going to get? I mean, through the House, I could see that happening. Through the Senate, it's not going to happen with Harry Reid.
Do you not think Harry Reid's going to be excited about this idea, giving states more flexibility?
Somehow you know a different Harry Reid than the one I'm watching up there, Congressman.
I don't, actually. I do think this is will have overwhelming support in the House because states are already requesting this. We're fulfilling it. Basically, the states have picked up the phone and asked if anyone in Washington, D.C. will answer the phone. This is us officially answering the phone and saying, yes, we do want to give that authority back to those states. Now the key is to be able to communicate to the American people, for those individuals to see it, and for the Supreme Court, not the Supreme Court, but they think they're the Supreme Court, for the Senate to be able to say, this is the decision that needs to be made. Now, here's the interesting thing about it is, I come from a Christian worldview in a biblical perspective. In Daniel chapter 1, Daniel, Shadrach, Meshach, and Abednego, or Hananiah, Mishael, Azariah, however you want to read that, they asked permission to say, let us eat vegetables. Let us try a different way of doing this and see if it doesn't turn out better. I'm trying to apply that same principle to say, allow these 8 states to try it and see if it doesn't work better.
Well, I think the audience here certainly likes it. All right, let's let the Senate changes hands this year, because I think we realize that in order for this to happen, the compact to be approved, the Senate would have to turn to a Republican majority and put Harry Reid in the back of the room instead of controlling the calendar. Now, does the president have to sign or sign off on the compact for it to be respected?
There is some dispute on that, actually, because there are federal dollars that are connected to it. Most of the compacts are just a legislative branch only. This one actually has the dollars. It basically block grants all those dollars, Medicare, Medicaid, S-CHIP, and all the Obamacare dollars back to the states, and says to them, you design your own system. So we'll have to work that out in the process of it. For me, it's important for me to get it out early and to say to states, we do trust you to be able to make these decisions. States already do Medicaid, and a lot of people don't know that. Medicaid is already run by the states. There's already a health care authority in every state. This would just give that state greater flexibility to take care of a larger group of people. And for anyone who says the states can't do better than the federal government, I would point them to a website. I would point them to Medicare fraud. I'd point them to durable medical equipment fraud. You're telling me the federal government's doing a great job of this? I'd say let's let the states try.
You know, I think it's a brilliant idea, and especially I like it because it's consistent with the 10th Amendment that says if it's not in the Constitution, then according to the 10th Amendment out of the Bill of Rights, it should be left with the states. And there's nothing in the Constitution that says the federal government ought to decide our doctors and insurance companies. I think you're onto something, Congressman, and I hope a lot more states than the first 8 will be joining you, and it becomes a national movement. Thanks so much for joining us to give us the insight into the proposal.
Thanks, Governor. Thank you.
Congressman James Lankford of Oklahoma joining us.